I talk like this. Welcome to the Pearlii Podcast. Okay, welcome back to the Pearlii Podcast. We've got a very special guest today, Dr. Jalal Khan.
Thanks so much for having me, Kyle.
And we've got an even more special guest. Who's this?
This is my son, Fawad.
Hello, Fawad. How are you?
Good.
Well, what we're talking about today is how can poor oral health impact your quality of life? We have a lot of followers on our Instagram, and people that download our app are generally a younger audience. So they might not realise later in life, if they don't take care of their oral health, what can happen. So Jalal, you've seen the entire spectrum in the chair as a dentist. Could you just speak to that a little bit?
Yeah, sure. I'll start by saying you only get one set of teeth after your adult teeth come through. And that's going to last you, from the age of about 10 onwards through to, let's say good life expectancy these days is maybe 85, 90 years old. Those teeth are going to last you 80 years. You've got to start looking after them from day one, because if you don't, at the age of 50 or 60, you start to lose a few teeth, and all of a sudden it impacts your confidence, it impacts your function, your ability to eat comfortably. So you've got to think a big picture, and that these teeth have got to last you a long time. And so, the spectrum of conditions that I've seen have been those that I always like to think of the older patients that I see who've invested money and time in coming regularly for the dental checkups over the years. And you can see their quality of life is beautiful. They're out and about, they've got no issues with smiling, eating whatever they like. And then you've got other elderly patients who, for whatever reason, not necessarily because of neglect, but because of other reasons as well, might be medical conditions, etc., it's resulted in tooth loss and degeneration of the oral tissues. And they might be struggling with dentures, and their quality of life is completely different. They kind of eat steaks, they've got sore spots in their dentures, the dentures might be moving around a little bit when they're talking, and it's just completely different. And so you've got the stereotype of, your grandma or your grandfather putting the dentures in the glass of water before they go to sleep. But that's real. And does the younger audience really want that?
Well, do you have any stories about some patients that you may have helped and you've changed their quality of life?
Yeah. So, there's a patient in his 50s, and he hadn't really looked after his teeth from the ages of about 20 through to 35. That's what, he came in as one of the comments that he made when we were taking his history. And he was kind of ready to make amends and make a commitment and an investment to improving the situation.
Yep.
And so when I went through and his mouth and did a chart, etc., many of his back teeth were suffering. And we were able to come up with a treatment plan that was going to take him back to full function and restore his mouth to full health. But it was quite a sizable treatment plan in terms of cost. And he was a bit stunned by it, because he's like, it costs this much to fix your teeth. Can you touch
what sort of ballpark if you haven't taken care of your oral health?
It can vary, there are high-end dentists are doing treatment plans that are in excess of $50,000, but then you get other treatment plans which are might only necessarily be $5,000 or $10,000, but that's still a lot of money as well.
Still a lot of money, yes.
And so this is how one dental implant with a crown on top of it, the ballpark figure or range is somewhere between $5,000 to $6,500
for one tooth.
For one tooth, that's what most dentists are charging in Australia, and so that's how important this is. And so he was surprised at the figure, but understood the situation and he was like, look, I'm here for a reason. I'm here to turn things around for myself. And so he made the investment. And he was so happy at the end of it all, because finally he was able to smile with confidence. He didn't have a missing tooth at the front. He was able to chew comfortably without any pain, which something he hadn't enjoyed for many years. And it really speaks nicely to the two aspects about the mouth which are important, and that is teeth and gums. Because if we think about oral hygiene and oral health, it really should be divided into. Okay, so what? You give me that one in a sec. You want to just go and play for a little bit, and then we'll give the.
We're leaving this in the show, by the way. I'm not cutting that. I was going to ask you about other health conditions. If you've got particularly poor gum health or gum disease, could you tell our listeners just a bit about the other diseases that are associated with poor oral health? Yeah,
definitely. So you've already touched on how, decayed teeth or missing teeth or discolored teeth from decay or infection, etc., can impact your function, can impact one's appearance and hence their confidence and self-esteem, their ability to get jobs, etc. But there's obviously this whole wider scope or approach to things, which is all about systemic implications on one's general health. And gum disease, which can result over time from not really brushing your gums properly and not really flossing regularly. Gum disease has been strongly linked to things like cardiovascular disease, diabetes. The bacteria that are involved in gum disease are also involved in the accumulation of the beta amyloid plaques that are found in Alzheimer's disease.
It's the bacteria in your gums that builds up.
Yes.
And does it just sort of move around the body then after there's been a build-up?
Exactly, because the mouth's a gateway to the body. So anything that's in the mouth can get anywhere into the body. And so Porphyromonas gingivitis, which is one of the bacteria implicated in gum disease, has also been found in these plaques that develop in the brain in Alzheimer's patients. So it's a very real and serious link between.
Why don't people give it enough? Why isn't it this more alarming? To look after your oral health, because you look at the stats, I think according to the ADA, 65% of Australians haven't been to the dentist in the last 2 years. I think only 50% of adults brush twice a day. Is it education? Like, why aren't people more worried about their oral health?
I think it's harder for them to do it because oral health isn't just necessarily done at home. It's also done with visits to the dentist for professional cleaning and maintenance.
Yep.
And that isn't covered by the government, at least for adults. And so that makes it harder. And all of a sudden, to invest $200 in getting your teeth checked and cleaned at the dentist, doing that twice a year, that for a lot of people is a lot of money, and they'd rather spend that money, or they don't necessarily have it available. So there's that aspect of it, the lack of government funding. I think there's been a lot of work done to raise awareness about these things. So there's no lack of awareness, I would say. But it's the cost, which I feel is the major barrier.
Yeah, there's a lot of studies that back that up. Cost is the major barrier. I think according to Choice, it was on average $231 to go in for a routine checkup and clean in Australia, which is insane. If you're doing that every 6 months, 12 months, it's a big hit to your wallet, particularly if you're younger or from a lower socioeconomic background. It's almost impossible.
And the thing is, people say that going to the dentist is expensive. Why are dentists so expensive? But what they don't understand is that doctors are also expensive. It's just that the doctors' visits are subsidized by the government. It costs at least $300,000 minimum to set up a fully functioning dental clinic.
Oh, I'm not having a go at the dentist.
I know, but
why is dentistry not covered? Why is it not a part of Medicare? Let's get into that.
I think it dates back to when Medicare was first introduced and whatever was going on at the time. It precedes my time, so I'm not necessarily too familiar with the details, and I won't necessarily want to weigh in on why or why isn't, because that's besides the point. Right now, the question that we should be asking is, what can we do now to get it on Medicare? And I think a really nice way is just to start small, and it just should be like, let's give every Australian 2 checkups and cleans a year.
And what sort of impact do you think that could have? Just the government not covering the more serious treatments, but just the routine checkups. What impact do you think that could have?
I think it would definitely reduce the incidence and severity of gum disease, which is important, because that's going to, as I've explained earlier, it's correlating to other general health conditions. So if we can, to mind the pun, put a dent in
there it is again.
in the government numbers or the health numbers that are associated with diabetes and things like that, just by reducing the incidence and severity of gum disease, how good would that be? And in addition to that, it's going to prevent a lot of future oral diseases from developing in the mouth. And if the dentists are going to find one or two teeth that have decay, patients are going to be aware of it. And so then they might prioritize it. They'll be like, okay, I know I've got one tooth up the top left that needs to get done. I might save up for that and look at getting it done in 3 months' time. Because a lot of the time, if patients know they've got a problem in their mouth, they're going to do something about it eventually, and they might work towards it. But sometimes...
Go ahead. Sorry.
But sometimes they don't necessarily know they've got it because they haven't been to the dentist.
This is what Pearlii is all about. This just awareness.
That's it.
We just want people looking in their mouth. We've got the AI overlay to capture the teeth and flag potential issues, but we're not a diagnostic tool. We just want you looking in your mouth, and then we hope. If you do see anything of concern, you can book an appointment. We've also got that feature in the app. We've got live booking capability with over 3,000 dentists around Australia, because you get the treatment you need earlier, and then you're aware of it at least. So it's not you're not oblivious to what's going on inside your mouth. This is the whole point of Pearlii is raising awareness about what's going on in your mouth, and then also educating you what options you have to improve your oral health. Good. So I'm glad we gave a little plug there for Pearlii while we're on the podcast. But I'm getting fired up about government's lack of funding for dental. It just seems like there's medicine and then there's dental. Just sort of always sits over here in policy.
Yes. Somehow the mouth got cut out of the body when health policy was being drawn up.
And it's not just Australia either. Like the US dental system is it's fucked. We'll bleep that. It's just dental somehow always just gets put to the side. Why is that?
I believe that it's not just doctors that are necessarily to blame for it. I think dentists may be willing to blame for it. Should be taking some blame for it as well. Like, I mean, if you really get into private conversations with dentists about it, a lot of them would be resistant to there being public funding.
I've heard that. I've heard similar from many dentists. Because all of a sudden they can't charge as much as they would normally do, and this and that, and it just misses the point. That there'd also be more oversight as well. I think dental. I was told this by a dentist. You can correct me. It's the only part of the body where the clinician is the judge and the jury. So you're allowed to do surgery in the mouth, and there's no regulatory oversight or checks. It's the only part of medicine where you can do that. You can do surgery and not have a regulator looking over you. Yeah, I mean, that's a good point. What I love about dentistry is that I'm the clinician, I do the investigations, I perform the treatment, and I can also do the follow-up and maintenance as well. So I do everything. That's what I love about it. It's pretty cool. I mean, there are like regulatory bodies in dentistry to keep us all in check and make sure that we're doing the right thing. But it's obviously not nearly as regulated as other areas of medicine. So yeah, I can understand what you're saying. The other thing I really wanted to talk about as well, just briefly, is jaws and breathing and stuff. I don't know if we've got time. No, we've got time. We'll finish up on this last point. But yeah, tell us about, is this about how it can impact your quality of life? So, I mean, in addition to teeth and gums, I think it's really important to look also at the aspect of jaws and breathing and how that can impact health. So by age 4, 75% of our facial development is complete. And so it's really important that children are able to breathe properly whilst they are young, because that's the time when their face is developing. And there are a lot of children that are growing up with nasal allergies and a difficulty breathing through their nose, maybe enlarged tonsils or adenoids, and it forces them to breathe through their mouth. And there's plenty of literature and research to show that mouth breathing is really bad for facial development. It leads to
maldevelopment of the face and the jaws, and this impacts the airway. So then children are not able to breathe properly once they grow up.
I've heard this. So you should
And
breathe through your nose, is what you're saying.
You should be breathing through your nose. Mouth breathing is pathological breathing. It is unhealthy in so many ways.
Wow.
It's not fun. It's not funny, and not just for children, but for adults as well. But I guess what I'm trying to do is raise awareness about the fact that parents need to be looking at their children and how they're breathing, particularly while they're sleeping, because that's when they're at rest.
Mm-hmm.
And they need to be taking the children for orthodontic checkups at around 6 or 7 onwards, because a lot of the early intervention orthodontics is very effective at getting children's development back on track before it's too late, while they're still growing. And because if that is not done for someone that's got mouth breathing and blocked nasal passages, etc., is that when jaw development goes off track, someone can't breathe properly as they get older, and it sets themselves up for things like snoring and sleep apnea, which are serious conditions because they impact one's quality of sleep. And when sleep quality is impacted because you can't breathe properly, every single chronic illness that is on the planet is in some way related to poor sleep quality.
Yeah, well said. Well said. All right. Well, it's quite a somber point to finish up on. But it is serious stuff. Looking after your oral health, it can have huge consequences later in life. Jalal, thank you so much for your time and your expertise, and just keep doing what you're doing, mate. We're big supporters here at Pearlii. I told him off show that we had a viewing when he was on the TV. SBS's Insight, and a feature on the oral health crisis in Australia, and Jalal was one of the stars, and we had our lunch and we watched him up on the big screen. So we're big fans of your work. Let us know if we can ever help in any way, but thank you again for your time.
Thank you so much, Carl. You're too kind. Cheers.
Thanks. And to our listeners, download the Pearlii app for free dental checkups using AI. Will help you be more aware of your teeth and the importance of looking after your oral health. Thanks, everyone.